Recognize the member for Cowichan Valley.
Thank you, Honourable Speaker. I am grateful for the opportunity to rise and speak to Bill 38, the Opioid Damages in Healthcare Cost Recovery Act. This is an important piece of legislation. I'm glad it is before the House for debate. As provincial leaders, we need to work together to reduce harm and stigma, address the root causes of the crisis, and support people struggling with mental health and addiction. The ability to recover costs would be an important advancement. It is vital as we move forward, however, that we carry the weight of every life loss and the struggle of every British Columbian still fighting the opioid crisis. We need to do this for them. And if the province is successful in its legal challenge, and I hope we are, the financial remuneration should go directly to helping the most vulnerable and helping those impacted by the opioid crisis. Following on the important points raised by the member for Vancouver-Langara and the Minister for Mental Health and Addictions, I'd like to speak to the report released last week from the Ministry of Public Safety and Solicitor General's Office called The Illicit Drug Overdose Deaths in BC, Findings of the Coroner's Investigation. This report provides more heartbreaking context to this crisis that we are in. It states, in recent years, a significant increase in drug-related deaths has affected families and communities across Canada. In British Columbia, unintentional illicit drug overdose deaths increased from 211 in 2010 to an estimated 1,450 in 2017. More than 3,400 people have died of illicit drug overdoses in BC since January 1st, 2016. The coroner's report summarized the data from illicit overdose deaths occurring in British Columbia between 2016 and 2017. It identifies differences and commonalities among people who have died of illicit drug overdoses, as well as the circumstances surrounding those deaths. I'd like to dedicate my time today to those findings and the people behind them. 81% of those who died were male. 65% had never been married. An additional 18% were separated or divorced. Most of them were in their 30s or 40s. The majority of people lived and overdosed in private residences. 13% of people in the study cohort were living in social or supportive or single-room occupancy housing. 9% were homeless. 44% were employed at the time of their death. Of those, 55% were employed in the trades and transport industries. 79% of people who died of illicit drug overdoses had contact with health services in the year preceding their death, and over half, 56% of those people had contacts for pain-related issues. More than half of the cohort were reported to have had a clinical diagnosis or anecdotal evidence of a mental health disorder. More than 3/4 of people were reported to have been regular or chronic users of illicit drugs. And the most frequently detected substances included fentanyl, 76% of deaths, cocaine, 51%, alcohol, 37%, and amphetamines at 33%. Illicit fentanyl was detected in a higher percentage of deaths among 15 to 29-year-olds compared with 30 to 49-year-olds and 50-plus-year-olds. And the majority of the people had used their drugs alone. This was true across all health authorities, health service delivery areas, and age groups. Even if they lived with others, they were alone at the time of their consumption and death. As Andrea Wu summarized in the Globe and Mail, quote, "They are mostly single men in their 30s and 40s, what otherwise would have been the prime of their lives. About half lived with mental health issues and about the same with physical pain. Half of them were employed, many working in trades, and when they overdosed and died, they were at home, alone. Fentanyl was in their systems." While we can't draw causational conclusions from this information, it is clear that our province is unwell. It is clear that young men in BC, especially those who work in trades, are facing challenges. Can we support them better? Is there something about trades in particular that puts them at risk? Is our economy building healthy communities? Or is it separating people? Is it causing pain, loneliness, making it harder for people to make connections, maintain relationships, and grow families. This spring, The Guardian in England published an article titled "Many of My Childhood Friends Are Dead" by Patrick Blennerhassett. The UK publication was writing about Kamloops, BC. I'd like to read some of that article into the House and into the record. Quote, "Our fathers were lunch pail baby boomers," Blennerhassett writes, "rigid backbones of the post-war world. Nobody asked them about their feelings because they were too busy working. But by the time my generation sprouted up, there was a new cultural and societal landscape, less stable employment, more job competition, and none of the positive coping mechanisms to face the world. We learned the traditional masculine characteristics of our fathers and other men in cities across rural Canada, ill-equipped to handle, let alone display emotion, unable to properly cope with psychological stress, and prone to view any form of vulnerability as weakness. Stoicism and anger were the primary emotions, great when facing death or danger, but crippling in everyday life, excellent on the hockey rink, but useless for navigating the rest of the 21st century." Blennerhassett continues in his article. A recent study published in the Canadian Journal of Psychiatry titled "Critical Issues in Men's Mental Health" outlines the male depressive syndrome. Diagnosis is tough. Men won't report depression nearly as much as women, but they will lash out in anger, abuse drugs and alcohol, and take life-threatening risks. Most Canadian men, the study says, use negative coping mechanisms to deal with their problems, which invariably makes them worse and can lead to substance abuse, depression, and ultimately suicide. Jeff Connors, a Kamloops-based counselor who focuses on men's mental health, said men come into his office regularly with no roadmap for how to talk about their struggles. Job losses are huge triggers for depression and drug and alcohol abuse, and Jeff's clients are weighed down with countless mental health issues and abusive dependencies. He said the important thing is to make sure the push to get guys to address their feeling isn't cast as a war against the other sex. He noted 80% of men in Canada want to become fathers, are at risk of passing on negative archetypes of masculinity down to their sons. He says, "I've seen this as an allied approach. We need to do this with women. This isn't men against women. One of the first things I did when I started focusing on men's mental health issues is I went to the Women's Resource Center and I said, look, I'm not against you. This isn't men's rights. I just want healthy men. I want healthy kids. And I want healthy communities." Connor's suggested solution is simple. Start more conversations. Force men's mental health issues out from under the rocks and into the sunlight. Get guys talking to each other, their spouses, friends, and family, anyone. "One night I had beers with friends," writes Blennerhassett in his article. "Each of us around the table knew at least a dozen guys we'd lost over the years, to suicide, to drug overdoses, workplace disasters, and car accidents. Compiling the names of the deceased felt like a never-ending search, and we felt like surviving soldiers of some grim, randomized war." Circling back to Bill 38, the Opioid Damages and Healthcare Cost Recovery Act, I agree with Minister Eby that the lawsuit is an important step to address, quote, corporate corruption and negligence associated with the opioid crisis. I also agree the logistical necessity of trying this case as a class action, and I feel hopeful it will build on the success of the Tobacco Damages and Health Cost Recovery Act. That said, as we debate the bill through the House, I hope we will also keep the larger picture in mind. That picture includes thousands of wonderful British Columbians already lost and countless others at risk. Thank you.